All right, let's begin this hour with some groundbreaking new research on the shingles vaccine. The South Korean study found the vaccine can lower the risk of heart disease by 23% for up to 8 years. The vaccine in that study was used in the U.S. until 2018, and other research shows promising results for the new version, which is used now. CBS News medical contributor Dr. Celine Gounder, editor-at-large for public health at KFF Health News, joins us now to discuss. Good to see you. Good morning.
Good morning.
So, break the study down for us. What did it find?
So they looked at over 2 million adults in South Korea over a period of about 10 years, and they found that people who got the older shingles vaccine, what we call Zostavax, it's a live virus vaccine, an older technology. In that population, we saw a 23% reduction in their risk of cardiovascular events, which is pretty significant.
Wow. So the study focused on this older vaccine, which, as you say, was used until 2018. The newer vaccine does not contain a live virus, but you're saying the new research is suggesting that it might even be better than the old one.
What we're seeing is the newer vaccine, so that one's called Shingles, which is made of a purified synthetic protein, viral protein, so it's much more pure. You get 2 doses of that one starting at age 50. With that one, we are seeing even better vaccine effectiveness, and we're seeing preliminary data showing that it too has cardiovascular protective effects.
So I got my shingles vaccine. I saw a commercial on TV and thought, I better get one of those.
Yeah, that's what I did. I booked mine for next week, Gayle.
Said, I better get one of those. So what does it mean for people who received the vaccine before 2018?
Well, the study we're talking about today is actually with that older vaccine. But I think big picture, we need to be rethinking the connection between infections and chronic disease. We've had this sort of artificial line between the two, and what we're seeing based on this data is that because of the chronic inflammation you can have from an infection like chickenpox. So chickenpox is the kind of herpes virus, and as you may know, once you have a herpes virus, you have it forever.
Forever, yes.
And if your immune system gets weak, you're getting older, you're stressed, it can come out again. And so it's causing inflammation over time in your body. When you have a shingles outbreak in particular, you're having a lot of inflammation. That can cause inflammation of your blood vessels, blood clotting, all of which could lead to a heart attack, dementia, these other problems. And so understanding that these things can be connected, infectious disease, chronic disease, I think is an important message here.
Yeah, you mentioned dementia. Another study showed that the same type of shingles vaccine could reduce the risk of dementia. Could this change the way that we think about vaccines?
I think it should. So again, we're trying to prevent some of the risk factors that lead to chronic disease, which includes chronic inflammation. Other such infections, chronic infections, hepatitis C, for example, has been known, or HPV, human papillomavirus. These have been known to cause cancer, again, through the chronic inflammation. So it's again, a false dichotomy between infectious disease, chronic disease, and vaccines may be a way of preventing certain chronic disease.
So bottom line, who should get it?
For the Shingrix, the newer vaccine in the United States, once you hit age 50, you should be getting 2 doses of that. And then if you're younger and immunocompromised, you should also be be two doses.
Okay, so all you guys at this table, you have some time.
Not me. I'm behind the times.
You two guys
We
on
have a
this
little
side have some time.
Behind the 8 ball as always.
You're over 50.
Yeah, well, now my mom's gonna yell at me because she doesn't like when people know my, yes, I'm way over.
Why? Why does your mom like that?
I'm glad. You're so youthful. Keep being youthful.
She liked the mystery.
Keep being youthful.
Oh, no, you're still youthful. I think it's good to tell people, look, this is what it looks like.
Yeah, exactly. This is
Never run
55.
away from that question. Dr. Gounder, always good to see you here.